So here's the chart for Christy test. You can see her problems, encounters, medications, etc. And the important piece that we always look at is the rules that we have for Christy. So we open up by single clicking on the number of rules. You can see the rules that apply for Christy. Because Christy has diabetes, dyslipidemia, and hypertension, she has multiple rules that provide the same requirements. We require fasting blood sugars annually on each of those conditions, so that will appear 3 times. When that is completed, those 3 rules will drop off. So while it says that there are 19 matches, there aren't in fact 19 actions that need to be taken. And a lot of these can be done just by one lab result. As you can see, most of those are lab tests. She also needs an ECG, she needs a PAP, and then all of her lab work. So most of that could be easily completed by the MOA at the visit by identifying with the nurse that she needs an ECG, having that completed, telling the physician that, or setting up for a PAP, checking her blood pressure, and then pulling out a lab rec and ordering all these tests, explaining to the patient that she's going to have to fast for some of these. But basically, this should be able to be completed at this visit. So when that is done, then tomorrow all of these rules will drop off. Now, some of the things that we are screening for in Wolf are items that would appear in documents, or it may be charted within a visit that you have talked to the patient about stopping smoking, you've talked to the patient about their exercise status, their alcohol consumption. You've counseled them that they should stop smoking, they should cut back on their drinking, they should exercise more, whatever it was you were discussing with them. If you just record those within an encounter visit, it's very, very difficult to then find that information. The way that we have established to do this is through manual lab results. So you'll see here for Christy that we have done a standing lab order for TSH for her. She has had a mini mental examination with her scores, PHQ-9s. So basically what we do is we do these as manual lab results. So to give you an example of how those are recorded, just right-click on the patient's chart, new manual result. We have 2 categories for these. We have a mental health, where we have all of the various screenings that we would do. So if we wanted to look at a PHQ-9 total score, you just click on that, you record the number, and then that will be recorded in the chart, and that becomes a searchable field. As well, we have all of our screening maneuvers. So blood work offered or refused. If a patient is a diabetic and you've given her a requisition for hemoglobin A1C or a fasting blood sugar or something where she needs to go away and get that done, you can record that here. So blood work offered, so I would record HbA1c as my test and save that. Now within investigations, you'll see that in the blood work offered, there's an HbA1c, and it shows you the date that you offered it. So if the patient does not get that completed, this is an easy place for a MOA to go look for this data. The other one that is the other ones that are quite useful is if you give someone a requisition for a mammogram, for instance. So I go into screenings and I go mammogram offered, and I would put the date that it was booked for would be the 25th of July 2013, and save that. Now we don't have to search through documents and try and find that referral. It's quite easy to go in here and see that she was offered a mammogram on this date. As well, if a patient tells you that she will never do a colonoscopy, you can go refused. And you could put in here will never do. Save that change. So now we have that in here. And the usefulness of this is that you can then create a rule that says you'll have a rule for colonoscopy or mammogram or PAPS or that sort of thing. And if the patient matches for that, you'll walk into the room and you'll say you need to have your PAP done or your colonoscopy done. The patient will say to you, I told you that I will never do that. But with this functionality, you can then create a rule as well. Show me all the patients who have refused a colonoscopy in the last 5 years, and that will also match on in their rules so that you'll see the patient should have a colonoscopy but has refused a colonoscopy. That saves the MOA or the nurse or the physician walking into the room and starting to talk about a screening measure that needs to be completed and upsetting the patient because they've refused it. Now you know that they have refused it in the past, and it will be a different conversation that takes place.